Chronic low back pain, or CLBP, is a widespread issue that affects millions of people worldwide, leading to significant disability and economic burden. While most acute back pain episodes resolve on their own, about 10% of cases progress to chronic pain, which can persist for years and severely impact quality of life. CLBP can be classified into different types based on its underlying cause: neuropathic, nociplastic, and nociceptive, with mechanical CLBP being the most common. Mechanical CLBP is often linked to problems with the multifidus muscles in the lower back, which play a crucial role in stabilizing the spine. When these muscles become weak or dysfunctional, it can lead to ongoing pain and instability. Traditional treatments like physical therapy, medications, and injections may offer temporary relief, but many patients continue to struggle with persistent symptoms. This has driven the search for more effective, long-term solutions. Multifidus muscles are deep back muscles that help stabilize the lumbar spine. In many cases of chronic mechanical low back pain, these muscles become inhibited or weakened due to a process called arthrogenic muscle inhibition. This can happen after an injury or as a result of ongoing pain, leading to a vicious cycle of muscle dysfunction, instability, and further pain. Patients often develop abnormal movement patterns, stiffness, and difficulty maintaining proper posture. Diagnostic tests like the prone instability test and multifidus lift test, along with imaging such as MRI or ultrasound, can help identify multifidus dysfunction. Unfortunately, even targeted physical therapy may not always be enough to restore proper muscle function, especially when pain and inhibition persist. This is where restorative neurostimulation comes into play, offering a new approach to break the cycle and restore stability. Restorative neurostimulation is a breakthrough therapy designed for patients with chronic mechanical low back pain and proven multifidus muscle dysfunction who have not found relief with conventional treatments. The most well-known system, Reactivate, uses an implantable device that delivers electrical stimulation to the nerves controlling the multifidus muscles. This stimulation helps override muscle inhibition, allowing the muscles to contract and regain their stabilizing function. Patients typically undergo 2 daily sessions, each lasting about 30 minutes, during which the device activates the muscles in a controlled manner. Over time, this therapy can restore neuromuscular control, improve spinal stability, and reduce pain. Clinical trials have shown significant and lasting improvements in pain, function, and quality of life for many patients, with benefits persisting for years. Importantly, this therapy is intended for those who have failed other treatments and are not candidates for spine surgery. Not every patient with low back pain is a candidate for restorative neurostimulation. Ideal candidates are adults with chronic, disabling mechanical low back pain linked to multifidus dysfunction, confirmed by clinical tests and imaging, who have not improved with medications or physical therapy and are not suitable for surgery. The process involves careful assessment, including medical history, physical exams, and sometimes psychological evaluation to ensure readiness for an implantable device. Once selected, patients are educated about the gradual nature of recovery, which typically begins with improved stability and function, followed by pain reduction over several months. Real-world studies and clinical trials have demonstrated that a majority of patients experience meaningful improvements, with many reducing or discontinuing pain medications. The therapy's safety profile is favorable, and its benefits can last for years, offering new hope for those living with chronic mechanical low back pain. As research continues, restorative neurostimulation may expand to help other types of chronic pain, such as neck or thoracic spine pain. For now, its primary focus remains on patients with severe, disabling, non-surgical mechanical low back pain due to multifidus dysfunction. Ongoing studies aim to better understand which patients benefit most and how to optimize treatment protocols. Multidisciplinary approach, combining pain management, physical therapy, and surgical expertise, remains essential for success. For patients who have exhausted other options, restorative neurostimulation represents a promising evidence-based solution that can restore function, reduce pain, and improve quality of life. As awareness grows, more patients and clinicians may consider this innovative therapy as a viable path to recovery from chronic low back pain.